My name is Dr. Shamsudeen Yusuf. I'm a consultant physician and nephrologist. When we come in, we have patients that satisfy the criteria for renal replacement therapy. That is the hemodialysis we do here. Most of them are referred from other centers. Some of them are admitted into the main hospital, orthopedic hospital. Some referred to this center. Most of them that come here doesn't have a central line. There's an access where we connect the patient to the machine. Mostly we use jugular or subclavian vein, sometimes femoral vein. Very few cases we have patient with AV fistula. We pass the central line and then we have nurses that start the patients on dialysis using the machines. We take a brief history, we examine, then we look at the results to confirm, yes, truly this patient has kidney disease. Most of them is acute on chronic kidney disease. After confirming, most of them have full-blown uremic symptoms. For the first session, we give them 2 hours. We render it intentionally ineffective to prevent a complication we call dialysis disequilibrium syndrome. Most of those that develop that complication end up in the ICU. So we give them 2 hours instead of the conventional 4 hours. It's 3 sessions per week on alternate days. We assess them at interval to know if the patient is doing well. When we started, we received very few patients because it was quite costly. But then recently, after some months, the governor subsidized it by 50%. So patients pay 25,000 naira now per session of hemodialysis, and you can see them coming. When we compare with other centers around in the Federal Teaching Hospital, in Kano, it's getting to 100,000, I think 90,000 or thereabout. So imagine 25,000. They call us themselves from there that we are sending patients to you. It's cheaper. Previously, there is a center in General Hospital Katsina, but it has been epileptic. Sometimes the machines are not functioning. So sometimes the patients get the consumables from the General Hospital and then take the materials to Federal Teaching Hospital and pay some token to be dialyzed. But with this center, new machines, new equipment, patients are actually getting the best. Another advantage is we have machines available for dialyzing septic patients, patients with hepatitis B virus infection, patients with hepatitis C virus, and then HIV patients. We have machines to dialyze them. We have many machines here, over 10 functional machines. There's need for more hands. I'm the only nephrologist here in the whole hospital. Though we have another doctor who is in training now. She's a resident in internal medicine. She has been very supportive, Dr. Zainab. But we started with 2 nurses. You can imagine having to come every day here, including public holidays and weekends. So there is no break at all. Yeah, we have some more nurses here. Recently, some were posted, like maybe 8 or 10 of them. So it's a bit easier now, at least. And I think improving the pay will attract others from coming here. It's natural. Once the gradient is higher, people will move from lower to upper. We have actually facilities and rooms for other services apart from nephrology. In fact, there's a place for expansion also in the future if we want to do things like renal transplant and the rest. But lack of enough hands is the major factor. Something has to attract healthcare professionals to Katsina. It's one of the best centers, honestly. We need more hands so that we can admit more patients comfortably. Many patients will come here unconscious in uremic encephalopathy. After dialysis, even before we finish, they start asking for food, recognizing their relatives, and so on. So we are happy the patients are doing very well. The care we are providing is quite adequate. Some of them had some sessions of dialysis and have had some recovery, especially those with acute kidney injury. and those with residual renal function. Some of them are off dialysis now. I'm in touch with many of them. They're doing very well.